Hello, everybody, and welcome to Tinker Talks. This is your audio format podcast talking about everything that is behind the fence line of Tinker Air Force Base. So today we're going to begin a series of a few podcasts about the coronavirus. I think it's safe to say that we all know something about coronavirus, or COVID-19 as we're calling it, so we don't need to cover a lot of the background about it. It was actually just a week ago that we had discussed doing our first COVID-19 podcast, and at that time the installation was in HPCon Alpha with 0 confirmed cases. So in just a matter of a few days, we can see how this thing is growing. We're now in health HPCon condition Charlie, and we have, at the time of this recording, 3 confirmed cases on the base. So it's time now that we begin this podcast and talking about COVID-19 for informational sake. So with that, this morning I have 3 members of our medical group team. We're joined by Colonel Jennifer Trinkle. She is the 72nd Med Group Commander. Major Trinette Flowers-Torres, the Public Health Commander. Colonel Cindy Graessle. Graessle? Is that how I say that, ma'am?
Yes, sir. Yes. Cindy Graessle.
She is the Public Health Emergency Officer. So thank you all for joining us this morning. And feel free to jump right in and
well, thank you for inviting us.
Don't be bashful. There's no cameras. This is just all audio. So, yes. So this is a very, obviously a very important topic to talk about right now. So we'll jump right in with, there's a lot of talk about the coronavirus and COVID-19, but can one of you help us get a better understanding of what is the distinction?
Well, this is Major Flowers-Torres, the only one in the global, by the way. I'll let you know from a public health perspective what that means to us. So we conduct medical surveillance, and there are over 200 known coronaviruses in circulation right now. The reason why we have this interest in the COVID-19 virus is the fact that it is new, it is novel, and it hasn't been introduced into the human population. When it appeared in December of last year, and it had such a significant effect on the health of the population in that certain part of the world and now globally, that's what made us take notice, because we don't have any medical treatments for this other than care. And so from a public health perspective, we want to conduct medical surveillance so that we can identify the health trends caused by the coronavirus or COVID-19 and identify any mitigating efforts we can implement to contain the spread if possible.
Okay, so is this COVID-19, is this a strand of a more well-known virus? Is that right? Is that in a layman's term?
Hi, this is Dr. Cindy Graessle. So the coronavirus is a type of virus, and we have, as Trinette said, we have over 200, and some of these live primarily in animals, and some make that jump into humans, such as the SARS virus, if you remember back in the early 2000s.
Sure.
So the coronavirus is the type of virus, and COVID-19 is actually what started out as the novel coronavirus of 2019. It's more of the disease that it causes. Okay. And if you want to get really geeky with this, this particular coronavirus, the actual virus name is the SARS-CoV-2. Okay. So if you remember the SARS-CoV, that's a sudden acute respiratory syndrome virus that we had in the early 2000s. This virus is very, very similar. It's a RNA virus as opposed to a DNA virus, and it shares a lot of the same genetics with that other prior virus.
What is an RNA virus? So
an RNA virus is a ribonuclease virus rather than the double-stranded virus of what other types of viruses have. I don't know any other way to explain that. But the virologists get very, very excited over that. So
right. Well, and not that I would, before we venture off too deep into all this, and we certainly wouldn't want to make light of COVID-19, but is it a more not as an intense a virus or sickness? Like is it like maybe it? I don't know what I'm trying to say here. Like it's not as
like a virulent
right,
strain.
Right.
So the first thing that we have to keep in mind is that we don't know a whole lot about this.
Right.
This is a brand new virus that has jumped into the human race.
Mm-hmm.
So we have no known prior immunity to this virus. That's what causes the problems. Now with influenza, the influenza virus, we see this every year. It's called seasonal influenza.
Right.
Sometimes it changes. It changes its genetics, which means that every year we have to get a new vaccination. Sometimes it changes so drastically that it causes a pandemic, like a pandemic influenza, which we've seen it in Hong Kong in the late 1960s. There was another influenza in the 1950s, and then, of course, the worst that we've seen was the, quote, the Spanish influenza pandemic in the late 1900s, or 1918, 1917 time frame.
Right.
So when these viruses mutate and they change their genetics and jump into the human form, and we don't have the prior immunity, that's what causes the problems.
Right.
And we just don't know. We don't have any information on, what is this long term going to cause? How is this going to progress? Things like that.
And from the public health perspective, we want to caveat for the seasonal influenza, we have something that we call herd immunity. And so that means there's a specific portion of the population that must be immunized against this particular virus to stop the human-to-human spread in the community. That's why we push getting your flu shot. Now, the percentage of the herd immunity is specific for each individual virus, but I'll give an example. So if we have virus X, if we can ensure that, let's say, 86% of the population is immunized against that virus, then whenever that virus is introduced into the population, we have enough people immunized so that it cannot spread.
Right.
So herd immunity in seasonal influenza is very important. We haven't gotten that or determined that percentage for this novel coronavirus because, again, it's new and we're gathering the information.
We don't know about it. It's like removing oxygen from a fire. Like the fire has no way to keep breathing and stay alive. And I think you made that kind of clear. Is what I was trying to get at was you keep hearing, from a lot of different people and rumors and corners out there that this isn't really a very harmful virus. And I think that, it may or may not be. We don't really know a whole lot about it yet, but it's important to make sure that we're still taking very precautionary matters to keep ourselves safe and to keep other people safe.
And I'm sorry, and this is Major Flowers, and I think harmful varies for different people. For example, the governor has terminated school for the rest of the year in the Oklahoma school system, rather the superintendent. And a lot of people are wondering why. Well, we have a lot of children in school who have senior citizens or elderly caregivers. So as of now, the majority of the people impacted by the COVID-19 are elderly. So in addition to stopping the spread of the virus within the pediatric population, we're also looking to prevent the spread of the disease in the population of senior citizens or elderly people who are taking care of their grandkids or their great-grandkids or their nieces or great-nieces, because it can have a more detrimental effect in that population. So that's a secondary effect, positive effect of having the schools closed for the rest of the school year. Now, as a parent, educationally, I have my own opinions, but that is one of the underlying reasons why the superintendent and the Department of Education thought that this was the correct measure to take.
Right, and I think that that's also an important thing to note is that while currently what the community and the medical community has seen was that it's impacting a certain population worse than others, but that doesn't mean that everybody doesn't have to do their part in making sure. I mean, so okay, if you feel like, well, I'm Superman, I'm 25 years old and I'm in great health, who cares? But that's not the point. Like the point is that you need to take the precautions and the safety to not pass it on to X number of other people that you can see. I don't know, it's like at times 4 or something that the numbers when people put it out there, how many people one person could impact over a period of time. So that's great information. And so, Colonel Trinkle, your team is now like full on COVID-19, and obviously a lot of things of having to change in your organization from the leadership standpoint. It's your responsibility to try to take your resources and readjust and maneuver on battling this thing for all the people here on base. So what types of measures have you had to take for your team to be successful in combating and just doing the day-to-day work and keeping the mission and the people safe?
Well, I will tell you, the last 2 weeks have been fast and furious. I know our patients, the base populace, our military members, have probably seen more change in the medical group in that time frame. We started by changing operations at our front door. Part of my job is to ensure that our patient population is safe and taken care of, but also to ensure the safety of my medical staff, right. And to ensure that we can fight this fight for as long as possible and deliver care and take care of people. So the first thing that we did is we started screening at the front door. So we are asking folks where they've been, who they've been in contact with, taking temperatures, and ensuring that we take care of folks that have flu-like symptoms outside, not inside. That's number one. I know that everybody has seen the changes with the pharmacy. We are now not filling scripts. No, there's nobody standing in the lobby. It's kind of very eerie for us, but we're doing everything through the drive-through to decrease that contamination or that contact that could happen for both patient and staff. Additionally, as we move forward in a lot of the HPCon measures, and we're in Charlie now, you're going to see that a lot of the interaction that you will have with the med group now is going to be almost over the phone. So we are switching to a lot more of what we call telemedicine or virtual appointments. So what we're asking is that when you are calling in to the medical group, for routine issues like medication refills, follow-up appointments, stuff like that, you'll probably be booked into a virtual appointment where a provider will actually call you back instead of coming in. Right. We may delay getting some labs. We may delay a follow-up appointment, but we will still take care of you. We'll still be in contact with you. What we do ask is that if you are sitting at home, self-isolating, and you feel like you need to have a physical done, please don't call in to book that. We are truly only taking care of urgent, emergent, necessary things right now over the phone and getting those things taken care of. If for some reason you truly need to be seen, you will be triaged via the phone. And if you really, really need to be seen, will be brought in based on that fact. Yeah. But these are kind of some of the changes that are going on right now. I know we are in the process of setting up a new tent right now in our parking lot, in the patient parking area, where we are going to actually have a cold flu clinic out front, just totally eliminating the possibility of any of those folks walking through our doors. So we do ask that you be patient with us. Right. This is going to cause some delays. There is going to be backup at the drive-through. We are trying diligently to try to ease that for everybody, knowing that this is going to be a constraint. But we just want to know that we are still here for you. We're still taking care of people, and we're still fighting this fight.
Right,
So.
And we're all in this together. So it's a great point, and we are getting a chance to hear that and communicate it, even from our side, about the empathy and being kind to one another. Like, now just is not the time to be snarky
Absolutely.
or mean or to people. Like, this is a time and I think we'll come there, because I think, as you've seen with everything that's ever happened, big events that have happened in the past, we managed to pull together and get to that point. We're so early on in this battle right now that, and I think it goes without saying for sure that your team, ma'am, is doing an incredible job at the way they have just, the way that you've put all this together so quickly and how everybody's adjusting. You've certainly had an interesting year changing over the entire med group and now coming to this. So You've seen a lot of unique things from a commander's perspective on what you've had to do with your medical team over the last year. It's very good.
Can I add something to that?
Of course, don't even ask. Jump. This is a conversation. Yes, jump right in.
Yeah, this is Dr. Graessle again. I just want to put a shout out to our Tinker medics. I think we have the best medics in the world.
We do.
They have just come together. I will give them an idea, and they're young and smart and just brilliant, and they'll fix it, they'll work it, they'll make it happen. And our team, Public Health, man, we have just the best public health team. Again, just a big shout out. And I so greatly appreciate all their help. So that's my plug for Tinker Medics.
And on top of that, too, when we say Tinker Medics, I mean, we have a plethora of not only active duty people, but civilians and contractors who are so dedicated. Just know that the medics out there are truly dedicated. They are just a great bunch of people, and I love working with them.
They are. It's a good
And
force.
I'm sorry, I would like to piggyback and shout out to our families that are supporting us. For my example, my husband, he's really stepped up. He has dinner ready and waiting. Our 2 kids, he's corralling them and keeping his sanity. So shout out to our families that are supporting us.
Wow, that's a great point. Yeah, we don't even think about that part of this whole entire mission. There's the home team that's just as valuable. Like, especially for you guys, where in your the medical teams all over the country, and you guys here, you're right into the middle of this whole thing. So you're gonna get worn out, and you need to stay healthy. You're certainly exposed more than anybody.
But we wear appropriate PPE.
That's right. We do take precautions. We do.
That's a very, very great
and
point.
I did laundry, just for the record.
That's a great point. And we are practicing our social distancing here as well, just for those who want to know. So the commander implemented a public health emergency recently. What exactly does that mean to our people out there? And I think there are some things that he now puts into your team's hand to kind of guide him on the way we need to be approaching this. What does that mean, ma'am?
So as the FEO, the Public Health Emergency Officer, I am charged by DODI to guide the installation commander whenever we come to the point where we need to declare a formal public health emergency, meaning that there is something out there that's affecting us on base and possibly the community that we need to help try to contain via our disease containment plan. A formal declaration of a public health emergency gives the installation commander certain emergency powers to do certain things to help contain the spread of this disease, this entity, this act of terrorism, whatever the case may be. In this case, it's COVID-19, a virus. For example, if there were a vaccine that were available for this, the installation commander under a declared public health emergency could direct that everyone receive this vaccine or receive a medication that would be handed out at a point of dispensing, a pod, if there were a medication or a vaccine available for whatever entity you're dealing with. So the declaration of a public health emergency gives the installation commander more authority to do things, restrict movement, force quarantine, force isolation, impart social distancing criteria, and for our civilian public health counterparts, it gives them the ability to request financing, to request the strategic national stockpile assets, and to request aid of like the National Guard and things like that.
Right.
So did you want to add further?
So just to expand, I forget what year it was, but when H1N1 became a pandemic, the president at the time and then certain installation commanders declared a public health emergency. And if you were an active duty member, that impacted you in the way that they created a vaccine within 6 months, which is totally unheard of, to combat H1N1. So that impacted the active duty members that year, in that we received 2 flu shots, basically. And so that was done under the public health emergency powers that are generated when a public health emergency is declared by either the Health and Human Services, the president, or the installation commander if you're following the DOD or federal government chains.
Right. And so, go ahead, ma'am.
Oh, and just an additional, with those powers, Colonel Filchak also has the ability to do stuff that people are going to see across the base now, where we're going to start probably screening at single points of entry across different base or buildings on base. Right. Doing certain things with the BX and the commissary to ensure that good order and discipline is taken care of across the base. Right. We may shut down gates, but the reason for that is so we don't expose our defenders to this as well, because they are a vital asset as well as medical. Right. So just adding on to those things.
And so under that authority, he takes a lot of this guidance from your team, correct? As far as what he can and can't do for the medical part, or maybe even some suggestions and guidance on maybe things he should think of as you guys try to get out there. And I think that you brought up a good point, Colonel Trinkle, about isolating. Like, that's one of the key ways to help us on the base, right, is to try to isolate and pin this thing down and to stop its movement, I guess, if you will.
Exactly. And, one of the things that we have really pushed is that, look, if you're not feeling well, stay home.
Right.
That's the biggest help for everybody, from the defender at the gate to the folks in the medical group to your coworkers. Mm-hmm. Just stay home, and
right.
and wait and see what happens. Wash your hands, social distance. All of these things play into that. That's how everyone out there can help us.
Right.
And social distance can be implemented in the workplace as well as at home. Mm-hmm. Instituting alternating cubicles to ensure there's a minimum of 3 to 6 feet distance between your coworkers, if that's a viable option in your workplace.
Right. And I mean, we've even done it down at our level just for lunch. Like, where you used to eat 5 or 6 people at a table, now you're eating 2 or 3 at a table, and you're spreading apart and doing our due diligence as well. But so, ma'am, you bring up if you don't feel well and just to stay at home, and that brings me to the question of, so you hear a lot about the 3 symptoms, right? The mm-hmm. 3 ones that everybody really is talking about out there in the public, and that's the fever, the cough, and what's the other one? Shortness of breath. Thank you. So, are there other symptoms that may, or have you guys seen in your case where somebody may not have one of these symptoms, but they have other symptoms that would be typical with a virus that maybe they should look for as well?
Yeah, that's the $1 million question. We wish that everyone who was carrying this virus had the symptoms so they could be identified, but unfortunately that's not the case. Mm. So you're absolutely right. Fever, cough, shortness of breath are the typical main symptoms, and for the most part, that's what we're seeing. The fever is kind of plus minus. You can still have the virus and not have a fever. However, for testing purposes, like if we want to collect a lab test and send it off to test for COVID-19, we're using a fever for part of that criteria. Mm-hmm. There's some other symptoms that have been reported out there in the literature, and the literature is kind of limited right now. And like I said, this is a new virus, and we're getting a lot of our data from China and from their scientists mm-hmm. that have published these studies. There are some potential, like body aches, headaches, diarrhea might be a symptom of this. It's probably not the main symptom that you're going to see first, which would be the fever, the cough, the shortness of breath, more of the upper respiratory concerns. Okay. But what cloudies the picture is that we're also in flu season, so we are having flu. We do have cases of strep throat going around, and with all the changing weather, allergies are just running rampant as well as we come into these days where it's really, really warm, really, really cold, really, really warm, and then the trees are blooming and we have a lot of pollen.
Right.
So there are other symptoms. It is basically presents like the flu mm-hmm. does. So the flu can present with an array of different symptoms. Our main ones, though, are fever, cough, and shortness of breath.
Okay. So like if somebody has a runny nose, say that isn't necessarily something that's tied to this virus. That would be more allergy? maybe?
Probably that it's probably more likely that it would be an allergen type symptom.
Runny nose and burning eyes.
Right. You just need to make sure what other symptoms are they having? What is their exposure? Are there any concerns that this could be COVID-19, travel history, things like that? Mm-hmm. So rule out the bad before you just assume that it's the the lesser.
And that's a good point, and maybe hopefully something that, all of us, and I'm not in the military anymore, but I was, and I still work in it, obviously, but checklists. So you're basically running down your own checklist of what to look for as you're, making sure. And again, I think it's important that, it can even happen on our installation with a smaller group of people to talk about, but you don't want to overrun our medical group, right? Like you don't, like you said, Colonel Trinkle, there are things that people should not be coming in for, or that maybe you should call for before you just drive out here and try to get seen by somebody. So run through that checklist and do your due diligence, and certainly because you are trying to help yourself, but you also want to make sure that our first responders and medical teams are not overrun so that they can take care of the necessities.
And that's an excellent point, too. With the elderly and those that have other medical conditions, this virus has hit them hard. Mm-hmm. So what we're seeing is that our community hospitals that have ICUs and emergency departments, they are extremely busy. So this is not the time to call 911 and go to the emergency department for just cough and cold symptoms. We do ask that we help out our brothers and sisters who are working as first responders and in the ICUs and emergency departments in our civilian communities. Please only go seek emergency care when it is truly emergent.
Right. How are you guys interacting with your community partners out there? Like, what are those conversations like?
That's a great question. Right now, it's kind of been a back and forth between supply issues and stuff like that. We do talk to our community partners on testing issues and stuff like that. We do have at least a good rapport with the VA of Oklahoma, Integris, OU. We're all partners in this.
Right.
And a lot of our patients are seen down there. Mm-hmm. So we rely on them heavily, especially when our patients do get ill and do have to seek the ER and stuff like that. So,
and so we talk about people. There's so much information running around out there. One of the things that a lot of people talk about is the surfaces that a virus could live on, right? And I know we had talked about this before we started recording, and there's lots of information and maybe general rule of thumb. So as the COVID-19 is something that we don't really know anything about yet, or the community doesn't, but is there a general rule of thumb on how long a virus can live on a surface, or what should people know about that, and even how to combat that, really?
Well, there's lots of stuff out there. Mm-hmm. And we have to remember, one, that we have actually taken a really close look at this virus since December. So that's not a long time to collect a lot of data, okay? And there are folks out there that are looking at how long the virus lives on a surface. And, Colonel Graessle and I, we've talked about this, and, the virus on different surfaces, like on copper, I think it's 4 days, and on a cardboard box, it's up to 24 hours. On hard surfaces, it could be up to upwards of a week. Mm-hmm. And when you look at that, you have to remember that is common areas that people are touching, okay?
Right.
So, you could touch a rail at a food court, okay? And if it is not cleaned or wiped down with a disinfectant, then it could last for a period of time, which is one of the reasons why we have really been pushing good disinfection. Right. We're asking folks, it's not just the washing of the hands and the using of hand sanitizers. It is wiping things down with Clorox or a bleach solution or a solution with alcohol. And this helps fight how long that virus lives on a surface. And that's what's so important to know about that.
And that's great information, because I think, people shouldn't get a false sense of safety because they think, okay, well, I haven't touched my refrigerator door in 24 hours, I'm good to go. Well, that's not the point. Like, the point is it's going to survive on a surface for a period of time. Disinfect and clean and clean your hands, and that's your only sure way of knowing that it's not still sitting on a surface.
And this is a message that the medical community pushes out every year, beginning with the flu season.
Right. Yeah, because and that's great to know, because we're not, this isn't specific to COVID-19, right? Like, you guys have been talking this in the medical profession community for ever since the beginning of time. I mean, you still have to do your part to make sure that this isn't that you're safe and that you're protecting other people.
And it is funny because, when the three of us talk and stuff, and Major Flowers, she does this all the time. She is a proponent of actual hand washing with soap and water.
Which is a good point. So is hand sanitizer effective on COVID-19 or I guess viruses in general, right?
Well, it is effective, but the best measure to take is hand washing, because you can use hand sanitizer and the virus or the bacteria will remain on the surface of your hand. Using soap and water, as our mothers and grandmothers told us as children, will remove the viruses and the bacteria from your hand, and that is the best measure to take.
It's bizarre how intelligent our mothers and grandmothers were when we didn't want to listen to that old thing. And the point is, like, we were talking about that, is that, like, I didn't honestly put two and two together where the virus isn't getting inside of my skin the second I touch it. Like, the water and the soap and the pushing it off you and running it down the sink is very effective. That's an effective maneuver. So that's good to know.
And Miss Kirtland, she works in our facility. She has a great picture that I stole from her with her approval that public health will now start implementing. So there was a school system. They did a test, and so they had students touch bread. And so they had one bread the student touched. They washed their hands with soap and water. They touched the bread, placed it in a Ziploc bag. Students didn't wash their hands, and they placed it in a Ziploc bag. And then they used hand sanitizer, and then they placed that piece of bread in a Ziploc bag. They went back to it. It's a science project, and a week later, the only slice of bread that did not have mold growing on it was the slice where the students had washed their hands. So that is a great picture of the efficacy of hand washing, using hand sanitizer, and not washing your hands. The best ever.
Right. And it's not to say that sanitizer is not good, because you did say it is effective, but maybe not for virus and type things like that. Sanitizer has its more beneficial uses for other types of germs.
Yes, if hand washing is not available to you at the moment, using hand sanitizer is great.
Good. And so, go ahead.
I'm sorry. No. If soap and water is not available, we do recommend using hand sanitizer. But the best measure for hygiene is washing your hands, as our aunties, grandmothers, and mothers and teachers told us so many years ago.
Right. And it's whatever we can do, right? I mean, it's even, who knows? You saw such a run on toilet paper and paper products when this all started. Then the hand sanitizer went. Soap seemed to still be in a good abundance out there, but who knows? The soap may be going away too. I mean, we have no idea how long this is going to last or hard it'll affect. So if it comes down to it and you have sanitizer and no soap, which at this point doesn't seem like the reality, but I guess it could happen, then one is better than nothing, right?
Exactly.
I mean, the point is to try to take precautions.
And I'm sorry, I just want to let you know that the Med Group hotline, we have a number you can call to ask any questions, and that's area code 405-582 6414.
Right, and that is posted on our website as well. We have set up a coronavirus information site on the Tinker Air Force Base website page, as well as I think you have it on the medical group website, which you guys have, that pushes down information from back in Virginia somewhere, I think, the Surgeon General's office maybe. So at this point here on Tinker, how or what are the conversations you guys are having to try to help slow down spread on our base itself within our fence line and our families, really, because we don't want to leave them out?
Right. Well, one of the things that we will do, and we have done, is institute what we call quarantine. If we get an individual, one that tests positive, or two that we feel is what we call a risk, we have a questionnaire that they will fill out. Public health will look through it. And if they are designated a high risk, then they will be placed into quarantine. And that is so that we don't have folks out there spreading that disease, touching things, and creating that vector for other folks.
Right.
Now that can be a challenge for a lot of folks. One of the biggest questions I think that we have fielded is, I'm COVID positive, but I go home to my family, and they're telling me to quarantine in place. And what does that mean? Well, what that means is that when that person is COVID positive and they go back into that home, they go into one room all by themselves. There is one bathroom that is designated for them and them alone. One trash can that is designated for them and them alone. They don't come out of that room and mingle with the rest of the family. They stay in that room. As a matter of fact, they're responsible in that room for washing down their sink and cleaning their toilet and making their bed. So you want to decrease contact with those folks as much as possible. You may have to leave food on the floor outside the door,
Right.
and they come and they get it and they bring it in. And just waiting that time period until the symptoms have resolved.
It seems almost radical and harsh in a way, but really, when you think it through, it's the stricter we are on this thing in the beginning, the quicker we can put a stop to it all and protect those of us out there in the community. And I think it's also important to note, we talked about your hotline that you guys have set up. We do also have the questionnaire. The screening questionnaire is on our website, and it's on the Tinker Facebook page as well. And so how are you guys encouraging people to use that screening questionnaire?
So there's a set of directions on the screening questionnaire that they can follow, and they send it to a particular org box. And so the questionnaire is reviewed by the medical team that we have at the clinic. And then based on the information, public health will reach out to the individual and have a conversation to do more investigation, ask more questions to get a fuller idea of the picture that's being presented. If the member does qualify for quarantine or qualify for testing, then we will bring in the supervisors. But there's two separate processes. So we have the medical surveillance piece where we will engage with the member and their supervisors for the quarantine aspect. So nothing is ever happening in a vacuum without the input of others.
Right. Good point. So I think we could probably talk about this all afternoon and evening, but it's probably a good stopping point. We don't want to tie up too much of you guys' hands, because I know you have a whole lot going on. You're pulling information for every single day and going into meetings every day and briefings and keeping the top leadership of the installation aware of what's going on. So with that, I thank all of you for taking time to come join us today and putting out some good information. I guess the cleaning and the do your due diligence, I think, is the best way to fight and the best message we can put out through all of this. Even if we knew what we knew, it's still, those are the best practices. Thank you all very much. And so with that, that brings to a close another edition of our Tinker Talks podcast. We will be talking to another couple of individuals from the Med Group about how to talk to your children and dealing with stress and anxiety, which I think those topics aren't being widely talked about just yet. But as we move through this time period, I think we'll see that that's going to come to light and be good information to know. So until next time, please don't forget to join us on another episode. Check out our Facebook page, please. There's so much information on our Facebook and our website. Our website has all of the latest information, and it's updated multiple times a day. So anything that's coming and happening to this installation that people need to know about, you will find it on the tinker.af.mil coronavirus website. Our Facebook page, Tinker Air Force Base. We also are out showing some photos of how we're handling the situation and kind of what the new norm for now looks like on the base in pictorial format. You can see that on our Facebook or Instagram site. And also our Twitter page, where you can get a lot of the more quick-hitting, impactful information that you need to know. That's at @team_tinker. And then again, if you'd just go ahead and give us your telephone number again. It's 582. That is the medical hotline, right?
Yes, and that runs 24 hours a day. We'll get it for you here.
6414.
582-6414.
6414. Awesome. So that is a very valuable resource that people who even just are a little, and we talk about, we're going to get into the anxiety part. Maybe if you're just having a little bit of anxiety about a symptom or two, call in, talk to a healthcare professional, and run down your checklist and do your due diligence. So until the next time we join up with the medical team for our next episode, everybody out there, please stay safe, wash your hands, do your due diligence in corralling this thing, and we'll go back to business as normal, hopefully. So till then, have a great day and great.